Hello guys, welcome all of you to today's Pharmcast. Today we'll discuss 5 drugs of choice, one anti-cancer drug and few questions which are asked by the students. Let us straight away begin with our drugs of choice for today. The first one is guys liver fluke, and there are two sides of liver fluke. One is fascioliasis whereas fasciola hepatica. The drug of choice is triclabendazole, but if it is liver fluke, that is clonorchiasis or opisthorchiasis, in this case your drug of choice is praziquantel, right? So depending upon which is the type of liver fluke, you can use either triclabendazole or praziquantel. Moving on to the second disorder for today, that is LUA. Guys, for LUA, the drug of choice is DEC or diethyl carbamazine. In case the patient has both LUA and onchocerca volvulus, in that case we begin the therapy with ivermectin and then we continue consolidation with diethyl carbamazine. The third disorder for today guys, it is lung cancer. Now remember guys, lung cancer, the universal drug of choice is cisplatin. Cisplatin is the drug of choice, and this is at most they ask you in lung cancer. Now if you go into classification non-small cell and small cell, that is a bit complicated and that is not commonly asked, right? So we'll skip that part. In lung cancer, just remember cisplatin is the drug of choice. Moving on to fourth disorder for today, lung flukes. Guys, lung flukes, drug of choice is praziquantel. And the last disorder for today, LGV, lymphogranuloma venerum. For LGV guys, the drug of choice is doxycycline. Whereas suppose I cannot use doxycycline or the female is pregnant, for example, in that case there is an alternative, that is azithromycin, right? So we can use either doxycycline or azithro. Overall drug of choice is doxy. If I cannot use doxy, I go for azithro, right? So these are the 5 different drugs of choice for today. We have moved on now to the second part of Pharmcast, where I discuss one anti-cancer drug. Guys, the drug I've chosen for today is rituximab. So all of you know rituximab is anti-CD20 monoclonal antibody, right? So target has also been asked in our exams. Now if you talk about the neoplastic uses of rituximab, there are 3 important uses. One is non-Hodgkin's lymphoma, where we use it in regimens like FCR, or that is for low-grade non-Hodgkin's lymphoma, or high-grade non-Hodgkin's lymphoma, we use a regimen called as CHOP-R. That R is rituximab. And it is also used in CLL, chronic lymphocytic leukemia, where the regimen is similar to the low-grade non-Hodgkin's lymphoma, that is FCR, right? So non-Hodgkin's lymphoma, chronic lymphocytic leukemia, it is also used in Kaposi sarcoma. And some of the important non-neoplastic uses of rituximab are disorders like rheumatoid arthritis and immune thrombocytopenic purpura. So these are the other uses of rituximab. Now finally guys, we have moved on to the last part of our Pharmcast, where I discuss few of your queries. So we have 2 queries to discuss today. First one, a student has asked, sir, how to effectively use pearls for revision? See, first of all, you need to know what are pearls. Pearls are the important consolidated facts, right, which will be most important in your revision in the last few days before the exam, when you don't have much time to revise the entire notes, right? So at that time you can just go through these pearls in the last 7 to 8 days before your exams. So currently what you need to do while you are revising your notes, do revise few pearls daily, and preferably guys revise those pearls of the subject you are revising, so you are in connect, right? And make a timetable for that, and you can just divide. Suppose you are revising 10 days pharmacology, right? So divide, suppose there are 50 pearls, so I'll divide 5 pearls one day. So 10 days I'll do my notes as well as 5 pearls each day, so 50 pearls. So you can devise a plan like that, and so that when at last you cannot revise all your notes, you can just utilize pearls as your important tool for last leg of revision. Second question guys, which has been asked by a student is, sir, I've watched only videos and not made any notes. I've just read the e-notes, and what should I do? Should I make notes now of important stuff? So what should I do? So yes, let me tell you something. Now it's not the time to make any drastic change to your plan, right? Each one of you must have made some plan, and now it is the time to stick to that, because making drastic change at the last moment can be counterproductive. So if you have not made any notes. So I guess you have a plan, and the plan was to revise from the e-notes. So continue your revision from the e-notes and revising the pearls as well, which you can use in the last leg of revision. And actually it differs from person to person what one is comfortable with. Like for example, I don't get a sense of satisfaction without reading or revising from a hard copy of notes, right? And but that is me, and it does not mean you have to be me, right? Times are changing, and many of you might have already adapted to the e-notes, and that is how times they evolve, we change. And if you believe in that, right, reading e-notes is your cup of tea, please go ahead with that, guys. So whatever you believe in, whatever plans you have made till now, it is the time to stick to those plans and not to make drastic changes, right? Nevertheless, you remember you're in the last leg of revision, and you should have a well planned, right, schedule, timetable, divided days, even hours every day for revision of a particular subject or a topic or a subtopic. So you should know, like, you're going for revision, you're going for the final kill, and how adequately you are going to revise, how productive your revision is, will ultimately decide what is the rank you are going to get. So guys, make this time, use of this time wisely during these time of revisions. Now remember, while you are in this phase of revision, right, always a kind of depression, it kinds to seep down into our confidence, and that happens because of the enormous amount of course that we have to revise. And remember, it is perfectly normal, right? Anybody could get into depression looking at the 19 subjects, the volume that you have to revise. But yes, what I'm telling you is it's perfectly normal, guys. You would have bouts of anxiety, depression, etc. But remember, you need to believe in yourself. You need to stick to your plans and take each step, one step every day, right? And gradually you will walk down this path of revision towards success, guys. So in entirety, the most important thing in this last leg of revision, in the last few months, is to keep that faith alive, keep that belief alive that you can do it, right? And whenever you have doubts in yourself, just remind yourself, why did you begin all this? What was your aim? Your aim was to get to that seat, and you have spent so many months toiling with your notes, videos, QBank, and guys, now it is not the time to give up, right? So keep yourself up, and believe me, if you have faith in yourself, if you believe that you're gonna get that rank, you will ultimately get that rank. So keep believing in yourself. That is one of the most important key in competitive exams. So that's all for today, guys. If you have any doubts related to your preparation, you can always let me know in the comment box. I would be more than happy to cover them up in one of my Pharmcast. So take care, bye-bye. This was Dr. Ranjan with you.